Fantastic. Well, good evening, everybody. It's great to be here and I look forward to the opportunity. So I'm a physician by training. I spent my early career in digital health before moving into pharmaceuticals and before becoming an entrepreneur for my sins. We at ScalaMed have created essentially a way to reinvent prescriptions, which haven't actually been touched in reality since their inception. We enable for the first time any doctor to send a prescription directly from any EMR directly to the patient's phone, putting the patient back in control over pharmacy selection and enabling us to create a really interesting touch point with which to access and ultimately influence patients and their outcomes. So the problem that we've been trying to solve is that there are 318,000 health apps on the App Store, and they're all looking to win patients' attention. And for the most part, real engagement is still elusive. And so every company with a health app is saying, what do we build? What feature could we have that's going to make our patients sticky to us and make them come back again and again? And we recognize that if you want patients to engage, you've got to give them something to do. The most frequent healthcare transaction is actually a prescription. And yet today, prescriptions for the most part bypass patients, sidelining patients because prescriptions flow from doctor to pharmacy. And at ScalaMed, we reinvented that and reinvented a way to take the most frequent healthcare transaction and create out of it a gateway for patient access and influence by sending the prescription first to the patient. The way it works is the next time a patient comes to you, rather than the patient saying, send it to Walgreens on Eastern Parkway, the patient can say, hey doc, send it to me by selecting ScalaMed as a pharmacy. Or the doctor, the physician can say, we now send prescriptions to you, select ScalaMed rather than Walgreens. And within a second, the patient gets a text to say your prescriptions have arrived on your phone. They click on the link and they open up any third-party app that is licensed our platform, where for the first time the patient can see good RX pricing, real-time benefit insurance pricing, and work out where their lowest cost pharmacy is prior to making a pharmacy selection. They can look to see which pharmacy is open at midnight. We educate them what the medicine is for and how they can use it safely and effectively. We warn them if accidentally a prescription is prescribed that there's an interaction warning. And within 3 clicks from their phone, the patient can select any pharmacy based on location, based on opening hours, and based on pricing to send the prescription for delivery or for pickup. But that's not the end of it. After setting the prescription, the ScalaMed platform enables us to come back and re-engage the patient, checking in, did they take the pills? Are they having side effects? And if there's an issue, being able to link them back appropriately, back into care. And so for anyone who's licensed our platform, it does 2 amazing things. Number 1, it brings their patients inside their platform. And secondly, enables them to then direct and influence patients in real time to help deliver a better outcome. As I mentioned, ScalaMed enables with a very, very easy 5 lines of code to enable our plug-and-play facility for this application to use in any health application. So if you're an insurance company, you can then have your patients' prescriptions your patients come back into your platform again and again to manage their prescriptions, to direct them to lower cost pharmacies or in-network pharmacies, and being able to support them with medication. If you're a telemedicine platform, telemedicine companies are able to ensure that when they prescribe, that they're able to keep those prescriptions inside their platform, reducing a lot of the burden of working out which pharmacy, and if the prescriptions end up at the wrong place, you're not going to get that phone call. And finally, pharmaceutical companies are able to roll out the velvet red carpet to be able to create a seamless experience to onboard a patient onto a specialty pharmacy, throwing on cash coupons, throwing on coupon support, education, patient support programs, and a hub-based program, as well as checking in with the patients to ensure they're actually taking their medicines. We started our journey with over 6,000 patients across sites in Texas. We proved that you could easily get patients to come on board out of any clinic. We got awesome provider feedback, nearly an 80% net promoter score, and have won a number of awards. We've got our first license, which is generating revenue, a second license coming on board now with our virtual primary care group, a third license with one of our largest PBMs in the country, and we're launching a bunch of parts at Mayo Clinic in Q4. As you can see, some of the pilots and some of the companies we're working with are at the top. We're increasingly growing our revenue. We're raising a $3 million seed round at this stage. We're onboarding customers, making the smartest prescription that exists today, creating an immense amount of clinical data to be able to prove out the impact that we're having on patients and on outcomes. And finally, we're creating a system where ScalaMed will become the new verb of prescribing. In very brief summary, we've reinvented a prescription. We've made it patient-centric, and we've created an opportunity to make a prescription a gateway for true patient access and influence. My final ask today is we are looking for new pilot sites with which to roll out our technology and also looking for good strategic investors. Thanks for the opportunity, and I'll hand over to Katie and some questions.
Great, thank you, Tal. Great presentation. This is exciting. A couple of questions that I have, because I think all of us probably know that there are other pharmacy services, other apps out there that patients and providers have to choose from. So why you? What makes ScalaMed best?
Yes, I think if you look, you're right. There are many people recognizing that the entire process of prescriptions are broken. There are many pharmacies and on our digital pharmacies, your Amazons, et cetera, that are looking to hijack your prescriptions and ensure that you send your prescriptions to them. But there's really no one who's truly sitting with the patient to try to give them back empowerment and control, so that with the complexity of pricing and information and working out what the right pharmacy is for them, that exists. So we really sit in that true no man's land where we sit aligned to outcomes, we sit aligned to the physician experience, we sit aligned to the patient to ensure that they get the best possible outcome from that medicine. If pricing is what they're looking for, they can find the lowest cost pricing. If it's about convenience, great. If they want a 24/7 record of their prescription, that's awesome. If they're a snowbird traveling across the country, we give them ownership over their prescriptions. And for anyone who's licensed our platform, it creates that access point where they gain visibility so they can proactively support patients in real time. And there is no one out there doing it the way that we are.
Very cool. So a couple of questions from our audience, and I had similar questions. So this seems like it would be a change in workflow. I mean, first of all, you and I know that physicians never like to change their workflow, right? But a change in workflow for healthcare providers, a change in workflow even for patients. Tell us about, I know you said 6,000 patients that you've had run through these kind of adoption studies. What were your adoption rates? What is it? Is it more difficult? Is the workflow easier? What have you heard from both patients and providers?
Yeah, so it's interesting. So we'll start on the provider side. So any provider that's ever had the question when they're managing a patient, when the patient says, hey, you know the CVS near the Lowe's? Have any of you tried to go inside your EMR and actually find that CVS near the Lowe's? That takes a good minute of your time working out which road it's on, what's the address. There are often four Walgreens on Main Street. So the ability for any physician to be able to say to a patient, like we used to do with paper, the ability to flick and forget, hey patient, I'm now giving you the prescription. This is a smart prescription. It's going to enable you to take it wherever you want. It's going to give you the pricing. So I'm not going to get a phone call back later on saying, hey doc, I'm at the pharmacy, never arrived, or hey doc, the price is wrong, or they're out of stock, or hey, I couldn't make it there because I had to pick up my daughter from ballet. Do you mind sending it to the Costco near the Lowe's? So it creates that ability for a physician to be able to practice, to be able to give the patient back control. For the patient, so from a workflow perspective, it's much easier to find ScalaMed inside your EMR, ScalaMed patient, rather than searching through the 15,000 Walgreens and working out which is the right Walgreens. So there is no change. It is integrated into every pharmacy or every physician e-prescribing workflow, and there should not be any change in workflow. In fact, we found from physicians told us in our rollouts, they saved about a minute per patient because when they saw ScalaMed as the selected pharmacy, they no longer needed to double check which pharmacy the patient wants because they knew that the prescription was going to flow directly to them. And on the patient side, yes, the first time you sign up, it takes our average is about 45 seconds to sign up to the platform. But beyond that point, the ability to have a portable, flexible prescription for a patient is outstanding. It's like the first time you ever used Uber. It's a delightful experience to now take over control over that prescription process, know where it is in the process, and be able to make that selection. So from the workflow perspective, we proved in our pilots that you could easily onboard more than 60% of all comers to a clinic. Patients loved it, and physicians saved themselves time.
Great. A couple of follow-up questions that have come as you were giving that answer. Which EMRs are you what would I say, not affiliated with, but maybe are you able to integrate with EMRs at this point? Is your platform able to, or is that necessary even to use ScalaMed?
There's no integration required. For many of the physicians on the phone, you could probably look at your platform today, create a prescription and go to select a pharmacy, and you'll find ScalaMed patient in there. The only reason that they may not, so it pretty much is in every single EMR that enables ePrescribing. So there is no reason for any integration. In terms of writing back those, so what we have over time is the ability to also enable groups who are involved in value-based care, the ability to see in real time, what did the patient even do with that prescription that I sent them? So if a patient receives a prescription with ScalaMed and they don't fill it after an hour, 4 hours, 24 hours, we prompt them, we nudge them, and then if they're really not doing the right thing, we can then link them back into care. And there are abilities then to write back into EMRs to be able to do that. We're working on some of those integrations as we speak.
Well, I'm assuming that would do great things for, let's say, medication adherence, and in the end, it's about patient outcomes, right? So one question, and this came not only from me, but also from someone in our audience, talk a little bit more about the Mayo Clinic pilots, and what are the clinical endpoints that you're looking for in those pilots?
Yeah, look, the two major foci of the endpoints there are looking mainly at quality improvement. So does it reduce workload on the physician side, which we're very confident it will? We've seen that in our initial pilots. Does it drive patients to better engage in the platform, better patient satisfaction, and then looking at adherence levels around the medications. One of the things about ScalaMed is today, if you're trying to look at adherence and you've sent a patient's prescription on their behalf to a pharmacy, so as a physician, you've taken on the burden of working out which is the right pharmacy and sending it there. What happens at a pharmacy is a pharmacist immediately processes that prescription. They push the claim through to the payer. So if you were actually to go in and have a look deep in the data and see what happened in that prescription, it actually appears like they picked it up and they filled it, when in reality, it sat on a brown paper bag on the shelf, and about a month after a couple of text messages to the patient, they reversed the transaction and pushed it through. So it's kind of that ability in real time to see what's happening and to be able to create that access point to the individual and back to the physician.
That's fantastic. Tal, we have several more questions from our audience, but we are getting to the end of time, and I like to end on time, so we'll have this full 30 minutes of networking time as well. But we really appreciate you being here this evening and telling us all about ScalaMed. This is exciting, and again, I could see this really impacting clinical outcomes in the end, so I'll be excited to see a little bit more about your pilots that are upcoming. Thank you for being here.
Awesome. Thanks, Katie. Thanks for the opportunity. Thanks, everyone, for being here.